So what is the prognosis for Achilles tendinopathy? Prognosis just basically means what can people expect over the course of time about how much improvement or lack of improvement am I going to make? All right. So remember that prognosis is an important educational component for your patients. So you have to kind of understand what the research shows in this regard in order to educate your patients. So how well people do obviously is going to depend very much on the study that you look at, right? So in runners, right, in one study, they're asking patients if they felt recovered over the course of time, right? And obviously, recovered is going to be different in meaning from person to person. Some folks may still have a decent amount of pain, but they may still say they feel recovered. And some folks will not say they feel recovered unless they have 100% resolution of symptoms and never, ever feel it ever again, right? So take that with a grain of salt. So in a running cohort, I think this was by the year mark, 2/3 of patients felt recovered. Okay. So 2/3 of folks are pretty happy with the recovery and they actually feel like they made a recovery over the course of time. However, if you look at other outcome measures, so one outcome measure that's used pretty frequently with Achilles tendon pain is the VISA A. Okay. And here's the thing. In patients that underwent physical therapy for the Achilles tendon, only 1/3 of patients fully recovered based on this VISA A outcome measure at the 1 year mark. Okay. So most of the patients, again, they feel like they make some progress and the outcome measure will reflect this. But at the 1 year mark, very few people are actually fully recovered. Okay. So when you're setting expectations for your patients, you got to tell them at least 12 weeks to see some progress, right? And the other piece is that don't expect this to be 100% fully recovered, right? Making progress over the course of time is what we're looking for. What influences your prognosis? Are there certain variables to look out for? So if I have too much body fat, right? If I smoke, does that increase my likelihood of having a poor outcome with physical therapy, right? So things like age, BMI, gender, duration of symptoms, the presence of ultrasound abnormalities. And here's the thing. None of these things seem to relate with long-term prognosis, okay? And to be honest, this is kind of different than what I've read in other tendons in the body. So in some places, BMI is not great for tendons, right? Smoking is not great for tendons. It seems like if you do smoke, it's going to reduce your ability to recover over the course of time. These authors found when they combed through all the literature that age, BMI, gender, duration of symptoms, and the presence of ultrasound abnormalities do not affect prognosis. Okay. So if you have someone that's overweight or they smoke, doesn't seem to affect whether or not they're going to get better over the course of time. If they have a super thick tendon, it doesn't necessarily influence your ability to get better over the course of time either. Okay. So keep that in mind for your patients. So let's go over some guidelines to tell your patients with Achilles tendinopathy. Like we said earlier, education is super important for these folks. What should you go over, right? So what's important to understand is that the majority of patients are going to recover over the course of time. However, your symptoms may persist in the long term. It's not really reasonable to think you're going to get 100% better, although certainly some people do, okay? So 23 to 37% of patients have persistent symptoms at the 10-year mark, despite performing physical therapy or some sort of treatment. Okay. So you're still going to have a subgroup of people. This is about a quarter of all people, a little more than that, actually still have symptoms 10 years after they've gotten Achilles tendinopathy and gotten their treatment. Okay. So the majority of athletes with Achilles tendinopathy are going to return back to sport. Okay. And this is probably going to vary depending on the sport. And the other piece is that we don't know if after these athletes return to sport, they still had some symptoms, right? Maybe they get back to sport, but it's still a little irritable, right? The other piece is that we don't know at what level of performance someone got back to. So let's say that you were, a highly paid professional soccer athlete, right? And you get Achilles tendinopathy and you're sidelined. When you return back to your sport, is your level of performance at the same level? Are you scoring as many goals? Are you running as fast, right? Is your endurance as good, right? Are athletes making the same amount of money, in the next 5 years after Achilles tendinopathy? We don't really know the answer to this, okay? However, most folks do seem to be getting back over the course of time. So you want to make sure you inform your patients about the inability to provide a long-term prognosis, right? Because the prognostic factors for long-term have not been identified just yet, okay? So we're kind of shooting in the dark here. We don't fully understand this. Over the course of time, obviously, we're going to get a little more research. We're going to guide our patients based on the information we do have, but let them know, hey, we don't know everything, right? So we're guessing a little bit. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a fitness pain-free mini course. Definitely check this out.